What postpartum strength training exercises are best for beginners? Imagine feeling stronger and more confident after having a baby. That's what gentle postpartum strength training can do for you. It's all about easing back into movement safely. When you start postpartum exercise, focus on slow, controlled movements. These help rebuild your core, strengthen your pelvic floor, and improve overall muscle tone without risking injury. Always check with your healthcare provider before beginning any new exercise routine. Begin with pelvic tilts. Lie on your back with knees bent and feet flat on the floor. Gently pull your belly button toward your spine to flatten your lower back against the ground. Hold for a few seconds, then relax. Repeat 10 to 15 times. This helps stretch and strengthen your lower back and pelvic muscles. Next, try glute bridges. Lie on your back with knees bent and feet flat. Engage your core and squeeze your glutes as you lift your hips toward the ceiling. Hold for a few seconds, then slowly lower. Do 10 to 15 repetitions. You can make it more challenging by placing your heels on a stability ball. The bird dog exercise is excellent for core stability. Start on all fours with shoulders over wrists and hips over knees. Extend one arm forward and the opposite leg back, keeping hips and shoulders square. Hold for a few seconds, then switch sides. Aim for 10 repetitions on each side. Heel slides are gentle but effective. Lie on your back with knees bent. Engage your core and slowly slide one heel away from your body, then back to start. Repeat on both sides, doing 10 to 15 reps. This targets the transverse abdominal muscle, which supports your core. Bodyweight squats help rebuild lower body strength. Stand with feet hip-width apart. Push your hips back and bend your knees as if sitting in a chair. Keep your knees over your toes. Rise back up to standing. Start with 10 repetitions and add more as you feel stronger. Use a chair for support if needed. Clamshells are great for hip stability. Lie on your side with knees bent and feet together. Keep your hips steady as you lift the top knee, then lower it back down. Do 10 to 15 repetitions on each side. Once you feel comfortable, you can add light weights for upper body exercises like bent-over rows, lateral raises, and bicep curls. Use small dumbbells, starting with 1 or 2 pounds, and focus on proper form. Remember, avoid exercises that strain your abdominal wall or pelvic floor, like sit-ups, crunches, or push-ups, until your doctor clears you. Focus on gradual progress, increasing repetitions or resistance slowly over time. Incorporate core engagement techniques, like exhaling during exertion, to support your deep core muscles. Use props like resistance bands or stability balls to modify exercises and keep things safe. Always listen to your body. If you feel pain or discomfort, stop and rest. Prioritize pelvic floor recovery exercises alongside strength training to support continence and organ health. Starting with these gentle, controlled exercises helps you rebuild strength safely. Over time, as your body heals and gets stronger, you can gradually increase intensity. This approach supports your postpartum recovery and sets a solid foundation for ongoing fitness.